Breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak in the nation. In just a few moments, we'll cut into the briefing at the Itaewon government complex with simultaneous interpretation available in English. We're going to go into the briefing room now, where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the coronavirus situation in the country. So he will be sharing the latest number of infection cases as well as updating us on the number of new deaths as a result of the coronavirus outbreak. And it looks like the briefing is going to begin soon, and there is Director General Yoon Tae-ho going to the podium.
Let us now begin our regular briefing for May 21st, Thursday. As of today midnight, we have 12 new cases. And in relation to Itaewon Club, there are 10 and other cluster infections, and 10 are infected domestically, while the rest of the 2 are imported cases. And the total number of confirmed cases now stands at 11,122. A total of 10,135 have been discharged, and 723 are in quarantine undergoing treatment. And we have conducted over 780,000 cases of diagnostic tests so far. And we had one more fatality as of yesterday, and the death toll now stands at 264. I extend my deepest condolences to the deceased and the members of the bereaved families. This morning, KCDC held a meeting presided over by Health Minister Bang Neung-hoo. We discussed measures to additional infections here in the metropolitan area, as well as the measures for reopening of schools for students who are high school seniors. And Health Minister Bang Neung-hoo has said that the senior students who have returned back to school have been returning back to school as of yesterday. And he says that we need to prioritize making them a healthy and safe environment. And at a time when we need to carry out our routine daily lives amid quarantine measures, he asked all of the public to comply with self-quarantine measures, including washing of their hands and wearing face masks. Next, it's the updates on the Itaewon Club cluster infection. And in relation to the club infection, as of midnight today, we have a total of 201 patients. And since the 6th of May, when we had the first confirmed case of the Itaewon case, there is no exponential surge in the number of cases. However, it is continuously increasing. And therefore, we cannot stay complacent on the further possible risks. And as for Incheon City, we are seeing increase of the infections across the metropolitan city. And yesterday, we have confirmed that a student, 2 high school senior students, have been confirmed via the coin singing rooms. And therefore, the Incheon City's 5 districts have ordered to close their 66 schools again. And we also have confirmed that these students have used the coin singing rooms at the same time. And we also confirmed that their families have also been infected. And also there were contacts and visitors who were at the same facilities, and we are currently conducting epidemiological investigation as well as continued testings. And starting from today, the Incheon City government is going to place a ban on gathering of all singing rooms, and all of the singing rooms will be banned from entry by teenagers, and coin singing rooms will be banned to the public. And therefore, the Incheon City will resume back to online classes for the students, and they will decide tomorrow afternoon whether they could resume offline classes. And we have also seen outbreaks in the hospitals in Samsung Medical Center as well as Gangnam Hospital in Yongin. However, we are seeing no additional cases so far, even after conducting a massive scale of the screening testings. And we are also continuously monitoring the situation and carrying out periodic testings. In particular, in Incheon as well as other metropolitan cities, these are places where there is a high traffic of people movement, and therefore it is very important to take preemptive and precautionary measures by tracing down the contacts as well as identifying the patients at an early pace. And therefore, the quarantine authorities are closely cooperating with the municipal governments. And if you have visited any of the places that have been revealed as the venues where the confirmed cases have went to, you also need to be tested as soon as possible. And when the epidemiological investigation is carried out further, we will provide further details of this outcome during our next briefings. And next is the reopening of schools for high school senior students. And yesterday, the high school seniors have returned to offline classes, and the Education Ministry has confirmed that we have a stable operation of our academic guidelines and school year. And detailed guidelines as well as detailed information will be revealed by the Education Ministry during their own briefing. And the government will also continue to intensify our quarantine measures and monitoring inspection of the places that students are utilizing. And yesterday alone, we carried out over nearly 8,000 study rooms and PC rooms that students are visiting, and a total of 30,000 places have been inspected so far. And we also placed administrative orders on some of these places. And in Incheon City, they have also separately conducted 12 administrative orders on facilities where there were not sufficient amount of quarantine measures, including the wearing of face masks. And also, we are continuously identifying any of the facilities that are failing to comply with these basic quarantine protocols. And we believe that the students need to be free of any further infection risks. And we also will need to inspect going forward any of the facilities that the students visit on a frequent basis. And next is about the management of the self-quarantine people. And as of the 20th of May, as of 6 p.m., we have a total of 46,000 self-quarantine, and a majority of them are infected cases here in Korea. And also we have about 20,000 of them who are the imported cases as imported people as well. And for those foreign entrants, we have put them in self-quarantine in about 100 facilities nationwide. And we also reported that 4 people have breached their self-quarantine measures, and one of them will need to wear the wristband, and they will be also accused and taken to the police. And also right now, we have a total of 20 people wearing this relief wristband. And starting from yesterday's resumption of offline classes, we continuously will have a phased offline classes resumption for other grades as well. And amongst COVID-19, we cannot halt our routine daily lives continuously. And always, we need to embrace the risks of a possible sporadic outbreak at any time and at any place. And we believe that we have successfully carried out our general elections last month amid COVID-19. This is a very important experience for us. And amongst this, we believe and we hope that we could have a successful quarantine scheme at schools as well. And as students resume to offline classes, we hope that the students can make memorable memories at schools. And in order to do so, we believe that every individuals need to also carry out quarantine measures going forward. And looking at the trends of outbreak, we have witnessed that hospitals and call centers and indoor sports places, they have been which have been under quarantine control. We have witnessed a limitation in the secondary infection. However, we believe that those have, with a lack of control, have saw an increase of surge in the number of confirmed cases. And at these facilities, we believe it was possible because of the people's participation in the quarantine measures, as well as the responsible quarantine measures put forth by each of the people working at these multi-use facilities. And instead of being too nervous about the outbreak, as we just did now, we need to further continue to practice quarantine measures going forward. This is very crucial. And a virus does not discriminate anyone in terms of gender, age, or race or district, and it also could infect you with no symptoms, and you could also infect others, and therefore it is not desirable to blame someone if they have been tested positive. And therefore at schools, if they have discriminations or accusing of the confirmed cases, we believe this could lead to further concealment of the infections. Therefore, we need to always remember that we are peers and colleagues in fighting against the virus, and please send your message of encouragement to your students as well as faculty members going forward. We need to make our new normal, and we are doing so together with the rest of the public, and please participate in our measures to ensure a safe environment for our future generations. Thank you very much.
That was a live briefing you just heard from the South Korean health authorities. We just heard that there were 12 new infection cases of COVID-19 in the country, bringing the total to 11,122. There was an additional death, and that brings the total death toll to 264. Well, that concludes our coverage of this morning's briefing. We'll be back in just a little while at 12 p.m. Korea time with our midday news. Bye for now.